Good evening. Thanks so much for joining us. We're so glad that you could be here tonight to talk about social anxiety in adolescents. My name is Dr. Nora Friedman. I'm one of the child, adolescent, and adult psychiatrists here at the Lurie Center.
And I'm Dr. Emily Hartnett. I'm one of the clinical psychologists here at the Lurie Center. We have a presentation today. You can type any questions you have into the chat. That's going to be the best way for us to keep track of questions. And then at the end, if we have extra time for questions, we'll get to all the chat questions that we can get to. And if you aren't comfortable using chat for whatever reason, there might be an opportunity for you to speak up then. But the chat is really the most efficient way for us. So I will share my screen to start us off. Okay, hopefully that's working. Nora, can you confirm? Okay, great.
Yes. Yeah.
All right. Just make sure I can, there we go. All right, so we're just going to start off with a basic description of what is social anxiety disorder. So social anxiety disorder has a very specific definition. Sometimes today we'll be talking about social anxiety disorder specifically, but sometimes we'll also be just talking about the symptom of social anxiety that gets in the way. So you'll see sometimes social anxiety disorder, other times you'll just see social anxiety. And we know that a lot of people struggle with social anxiety, some of which do not meet criteria for social anxiety disorder, and a lot of which do. So we'll talk a little bit about what is the disorder. This is just sort of directly from our manual here, but it's significant fear or anxiety about social situations where you're involved in something that could be possible scrutiny. This could have a really broad definition, but it can be things like times where you need to perform, like public speaking. It could be conversations or small talk. It could be going to social events or gatherings, being in large groups or small groups. But it's where you could be exposed to others looking at you, scrutinizing you, thinking about you. And the second symptom that is necessary is that people fear that they'll show their anxiety symptoms or that they'll act in a way that will be negatively evaluated by other people. So this could be feeling worried about being embarrassed, or that other people will notice that you're blushing, or that you are tripping over your words, things like that. Just to sort of round this out, it does need to almost always provoke fear or anxiety. This is not a one-time thing, or every once in a while I feel some anxiety. In order to have social anxiety disorder, it needs to be pretty persistent. It needs to either be the social situations are avoided, or when you do go do the social situations, you have intense anxiety. And the sort of tricky part here is that the anxiety needs to be out of proportion with the actual threat. So if you're in a really threatening social situation, and you have a lot of anxiety about it, that makes a lot of sense. A lot of us experience that, but this needs to be that your anxiety is a little higher than one might expect for the level of actual threat in the situation. And in order to qualify as a disorder, it needs to cause some significant distress or impairment, like difficulty functioning on a day-to-day basis, doing things that you want to do and enjoy, doing things like getting a job or maintaining relationships to the level that you'd like. You'll see that in the manual here, it says that it can't be due to autism spectrum disorder, which is a little bit tricky. And we're going to parse this out a little bit tonight of what would be expected anxiety as part of autism spectrum disorder and what is social anxiety disorder. So just quickly, in the general population, the prevalence of social anxiety disorder is about 7 to 13% of the general population. The average age of onset is about age 13. So that's why we're talking about adolescents tonight. Some children do have social anxiety disorder, but it's most common that it comes on early adolescence. But some people can experience it earlier or later. And it's slightly more common in cis women than cis men, and in trans women than trans men, but there's been a lot of studies on this that show that it's actually more even split between the sexes than a lot of other anxiety disorders, which are heavily skewed towards cis women. So in adolescents and adults with autism spectrum disorder diagnosed, and most of the studies are on folks with IQ above 70, although we know that some people with an IQ below 70 in the intellectual disability range still experience social anxiety disorder. And we'll talk a little bit about that. But most of the studies have been on folks with without intellectual disability. The numbers are actually much higher than the 7 to 13% in the general population. A lot of studies have found right around 50% of adolescents or adults on the autism spectrum diagnosed are diagnosed with social anxiety disorder in controlled studies. So this is a big difference and something that is really important to our work here, because we see a lot of folks on the autism spectrum and we see a lot of folks with social anxiety. So that's why we're talking about this today. As I said, there's some complexities, and if you imagine that this number is so much higher than the general population, there must be a reason why. Every individual is going to be different, why each individual experiences social anxiety, but there's a few reasons that researchers have come up with to kind of explain some of this increased prevalence. One is that some folks with social difficulties or social differences can experience social rejection or have negative experiences as they're growing up and going through adolescence and adulthood. And we do know that when people have difficult experiences, it makes their social anxiety go up. This makes sense because social anxiety is meant to protect us from difficult experiences socially and keep us socially safe. And so if you've had experiences in the past, your system is more likely to be heightened and on alert for more difficulties in the future. We also know that if you have difficulty predicting social situations, that makes sense that your social anxiety would go up. It's hard to predict how is someone gonna react, what are they gonna say. That's unnerving, it's anxiety provoking. We also have seen from the research that when people social camouflage, this is a term that's used a lot in the research, but it refers to when people try to hide symptoms of autism or differences related to their autistic identity, that sometimes this can increase social anxiety, worrying if people are noticing autistic symptoms or differences or autistic behaviors. And so social camouflaging can also increase social anxiety in those that do that. And then one of the last research studies that I found interesting was that when folks have a gap between what they know they should do in a social situation or should do, and when they experience difficulties with social success, and there's a gap there, I know what I kind of would be doing if I was fitting in well, I kind of know what to do, but it's just not going quite right. That gap can be really stressful, trying to understand how you fit into the social atmosphere. Finally, I wanted to say here that social interest and motivation can really play a part here. A lot of folks on the autism spectrum have high social interest and motivation, some don't. There's a lot of variability in what people are interested in doing with others, how much they're interested in interacting. And sometimes it can get confused if someone is seeming to avoid social contact. Sometimes that can be labeled as social anxiety because that's how some people react when they're socially anxious. But it could be because the person is not terribly interested in that particular type of interaction. And it's not avoidance, it's just disinterest or discomfort with something else about the situation, like the sensory stimulation or something like that. And finally, I talked about this a little bit, not much research has been done on lower verbal populations or lower cognitive populations, but if you have difficulty with emotion labeling or verbal skills, it might be really hard to describe what you're thinking and feeling when you are not wanting to do a social situation, avoiding, or seeming to retreat. That last criteria of you need to have a fear of being negatively evaluated by others that we talked about, some people might not express it that way or might not be able to describe what they're feeling or thinking. And so this can sometimes lead to people not being diagnosed with social anxiety disorder or actually just not having social anxiety. It really depends on the person and what they're able to describe. But sometimes that can come into play, and that comes into play in the numbers and the research a little bit, that we might be underestimating some folks' social anxiety if they're not able to explain it or to meet this particular criteria of social anxiety disorder.
Great. So when we're thinking about the prevalence of social anxiety disorder, we really need to talk for a few minutes about social media use. And what you see here is some data from a 2022 Pew Research Center survey that evaluated teenagers and their social media use, so ages 13 to 17. And the chart on the right, forgive me, actually compares data from the 2014-2015 study to that from 2022. And you can see that the percentage of daily internet users, whether it was once a day, several times a day, or almost constantly, rose from 92% to 97% over those years. What's more stunning and impressive is that the percentage of teens who reported almost constant online use doubled from 24% in 2014-2015 to 46% in 2022. And on the left, you can see that the most popular social media sites was YouTube, with 60% of teens using it almost constantly or visiting it several times a day. So social media is clearly a really prominent feature of adolescence and something that we need to take into account when we're thinking about anxiety and social anxiety symptoms specifically. Next slide. Thank you. So social media can have both positive and negative effects on mental health and well-being. First, it provides opportunities for connection and community building. And it's really helpful in that it removes the stress of in-person interactions. And that's a particular boon for patients who struggle with social anxiety. But social media use can also intensify feelings of isolation and loneliness. People often will have a sense of being excluded or missing out on experiences. There are concerns about online harassment, cyberbullying. So there are some really significant issues that we need to think about. And one of the most important things that we can do as parents and caregivers and families is to make sure that we're in dialogue with our teens around healthy online behaviors, boundaries, limit setting, and how their consumption of social media may influence their sense of self, their mood, and their anxiety. Slide. And we also wanted to take a moment to mention the COVID-19 pandemic. So as you all know and have experienced, the pandemic really fundamentally disrupted our daily routines, transformed our school and work settings, impacted our interactions with family and friends, ushered in concerns about health and safety, and left many of us with a lingering sense of uncertainty about the future. And there were headlines, both in academic journals and in the popular media, calling attention to the effects of the pandemic on youth mental health. So in October 2021, the American Academy of Pediatrics, the American Academy of Child and Adolescent Psychiatry, and the Children's Hospital Association declared a national emergency in child and adolescent mental health. And just a month later, the US Surgeon General issued an advisory which underscored the youth mental health crisis as well. And this wasn't just due to the pandemic. A lot of these concerns had been percolating prior to COVID, but were certainly exacerbated with the outbreak of the pandemic. Next slide. Emily, next slide. Thank you. When there were a number of studies and sort of meta-analysis where they looked at all the studies that had been published over a certain time frame to get a sense of what the impact of COVID-19 was on child and adolescent mental health. And what they found was that globally, the rates of depression and anxiety doubled in the first year of the pandemic. So 1 in 4 youth had clinically elevated depression symptoms, and 1 in 5 youth had clinically elevated anxiety symptoms. Studies also showed that there were more severe emotional and anxious symptoms in neurodiverse children and adolescents compared to non-neurodiverse youth in that first year of the pandemic. So really highlighting some of the issues and concerns. And this was a study that looked at, came out of Long Island. It was a sample, I think, of about 450 participants. And Long Island was one of the initial hotbeds of the COVID pandemic. And what you can see is that the rates of panic and somatic symptoms, anxiety symptoms, and social anxiety did increase over the course of the pandemic. And when the researchers looked at specific pandemic-related experiences, they found that greater COVID-19 infection and school concerns were associated with increased social anxiety symptoms, while home confinement was actually associated with reduction in social anxiety symptoms. Next slide. So what we know is that it's a complicated picture, right? We had stay-at-home orders, remote school and work, disruptions to routine, reduced social interactions, pandemic-related worries. And people responded differently to those changes. So for some individuals, isolating at home actually eliminated the stress that comes with in-person interactions and community outings, and that offered a much more comfortable environment for them. Similarly, some students may have found online learning with its decreased social demands far preferable to in-person school. And as clinicians, we really have to think through with patients and families what their unique experiences were during the pandemic, given all of these competing challenges. I also just want to highlight that COVID and the precautions that we were putting into place really led to a great deal of avoidant behavior, much of it sanctioned by public health figures, by physicians, by families. And we were staying away from crowded places, avoiding indoor gatherings, taking precautions to keep ourselves safe. And a lot of those behavioral changes likely strengthened anxiety and social anxiety symptoms. And Dr. Hartnett will explore the relationship between anxiety and avoidance in more detail in a few minutes. But I also want to point out that one of the challenges came as people later in the pandemic sort of resumed regular life, returned to in-person school and work and social gatherings. And that re-entry may actually have caused an increase in anxiety as well, right? If you spent several months avoiding people, trying to protect your health, and suddenly you're back at school without masks on in a crowded supermarket, on the T, or taking an airplane, those can be really stressful experiences for people.
Sorry, that leads us to how can we help? I'm a psychologist, and so I do a lot of cognitive behavioral treatment. And Dr. Friedman will talk a little bit about medications at the end, but I wanted to talk a little bit about how can we help with social anxiety. So this is from a clinician perspective. This is what I would do in treatment with someone with social anxiety. You can do individual or group treatment for social anxiety. Some people prefer one or the other or benefit more from one or the other. Groups have the benefit of having built-in practice, but also that downside of having built-in stressors that might make it harder to engage. What I always start with in treatment is understanding social anxiety, anxiety in general, and the avoidance cycle, which we'll talk about in a moment. Then we usually address fears of negative evaluation. So this is challenging any unhelpful thoughts, figuring out what is the person worried about happening in a social situation, if they can verbalize that. Thinking through, is this likely and realistic? Are there other options of what could happen? And then the most important thing in my mind is we do exposure exercises. So these are exercises that we do purposefully, mindfully, and we choose them in an order that goes up and up and up. Oh, I had a change on this slide. I think I'm using an old version. And so we try to choose something that's easy to start with and get that person to start engaging in that social activity in a way that feels a little bit safer. But then we will see what really does happen when we engage in that social conversation, or when we ask that friend to spend time with us, or when we give that small talk that's not as big as the ones that we usually are worried about. And so we will work through a series of exposure exercises that can help the person gain comfort and confidence, as well as to help their brain sort of rewire around new ideas about social situations. We always work on coping skill development because anxiety can be really hard to manage. We work on social skill development as needed, because if you truly are not sure what to do in a social situation, it can be really stressful. And sometimes learning some social skills around that type of situation or practicing them can give you more confidence and ability to take that step into an exposure exercise. And then finally, we try to reduce accommodation and avoidance at home. Sometimes with teenagers or adults who live at home, we might work with parents or other family members to help reduce accommodation. We always try to set a plan for reducing avoidance as things come up in daily life. Okay. So this is the avoidance cycle. The first thing I wanted to say is that avoidance is really, really natural. It is normal that when you are anxious about something, that your brain would be reluctant to go into that situation. Anxiety is our brain's system for keeping us safe. It tells us there's a perceived threat, and it usually tells us to avoid or escape, or to kind of freeze and shut down. And that's a really natural and normal part of our brain's process. This is what I always tell patients, so telling you too. And it's very natural that when you're anxious about a social situation, let's say having a conversation with a classmate casually, you might avoid that situation because your brain is telling you maybe it's a threat. Something bad could happen. They could think poorly of me. They could think I was silly. I could stumble over my words, or I could get really sweaty, and then they would know that I was anxious. When you avoid, it gives you some short-term relief. It feels good to be out of that situation. Okay, I was going to go over there and talk to them, but like, no, I can't. It's too anxiety provoking. Okay, feel a little better. That short-term relief feels really good to our brain. The problem is that our brain gets that little bit of relief, and our brain sort of does this behind-the-scenes calculation that says, I'm glad I got out of there. That must have been a really dangerous situation. That's what our anxiety system is for. So I set off the alarm. I got out of there. I felt better. Worked, right? The problem is that when we avoid like that, we get that little relief. Our brain labels the situation as probably dangerous. And then the next time we hit that situation, what are we going to do? Of course, it's probably dangerous. We're going to avoid it. And it strengthens over time that cognitive fear of something bad is going to happen if I go into this interaction. They're going to hate me. They're going to reject me, whatever it is. And when you get that short-term relief, it acts as sort of a reinforcer. It feels good to our brain. And so it says, next time, that worked really well. I'm going to do that again. I'm going to avoid next time too. So that behavior gets stronger over time as well. So this is what we have to recognize when someone is experiencing a lot of social anxiety. So usually it builds up over time with a perceived threat, which might come from some level of real threats, like we've been rejected or been ridiculed or something like that. We have a perceived threat, we avoid, it reinforces it, and it reinforces that belief that that situation was probably dangerous and it's a good thing we got out of there. And then our anxiety grows over time. So in treatment, what we try to do is, instead of avoid, we approach, but we do it in a really purposeful and mindful way. So we start with something easy, and then we move our way up, and we do it mindfully, which means that we are trying to pay attention to what we're doing. If we're having a conversation, we're trying to pay attention to the person we're having a conversation with, trying to notice, how did that go? Did the thing I was worried about actually happen? To a high degree, to a low degree, not at all. And we get some disconfirming evidence. Our brain goes, I thought that was going to be really bad. And it was only like stressful, but nothing bad happened. And it makes it a little bit easier to try it the next time. And then we move up and up and up until the person is reaching their goals of what kind of social activities they want to be involved in. Sounds easy like this. It's not. If you've ever experienced social anxiety, you know that taking that first step of approach instead of avoid goes against all our natural instincts. That's why I say avoidance is really natural. But it takes a lot of bravery, and a lot of the folks that I work with do this every day and taking really good steps to kind of work towards the life that they want. So here are a few examples of exposure exercises we might do, and these are just kind of random because everyone's worries are different. So you might wave when someone passes you. I do a lot of mock phone calls, mock conversations with folks just to get that experience of the discomfort of stumbling over your words or not knowing what to say exactly, or maybe saying the wrong thing or pauses. For some people, it might be just interacting with the clerk at a grocery store could be anxiety provoking, or sometimes we'll do ones to provoke that embarrassment and see that nothing bad happens, or people don't actually really even notice us, like walking across the waiting room wearing a silly hat. And we might do really practical things like, you've been wanting to hang out with this friend, but you're too anxious. Let's compose a text. Let's get the that approach going and push send. And then we can see what happens. Do they completely ignore you and hate you forever? Probably not, but we'll find out. And so depending on the person, exposures could look really different. I wanted to throw this in here. This pulls together some of what I've already talked about, but if you're supporting someone with social anxiety, if they're verbal, you can ask about their fears and try to really understand, because I think a lot of us assume that the person is worried about what we're worried about, and they might be worried about something completely different. I find that when I'm first meeting with people and they tell me that a situation was stressful for them, my brain often goes, oh, they're probably worried about, saying the wrong thing or making a joke that was not laughed at or something. And sometimes I'm really surprised. So listen to understand, and then approach the situation with empathy and a desire to help them live a valued life. This is really important because not everybody has to be a public speaker, but you might need to want to do well in class. And so you need to do the level of being able to do well in class, but you don't have to try out for the school play if you don't really enjoy that. If you want to be having a lot of friends and being a social butterfly, then that's the goal, is to get you more comfortable to doing a lot of social things. If you just want to be able to talk to a teacher and your two best friends without as much discomfort, then that's the goal. We're working towards living a valued life. We also break things into smaller parts. When we're problem solving, sometimes it's really hard to know what to do when you're feeling that anxious. And so if you're working with someone in your life, help them break it into a smaller, more manageable task. If the party is just too overwhelming, maybe set a goal of going for 5 minutes. And then if you're ready to be done, you can go. Or maybe you say you don't feel ready to, talk to the teacher about your bad grade right now. Maybe you can just break the ice by talking to the teacher and asking what the homework is. Help them break it down into smaller parts so that they can get those little steps. You can also role play just like I do. Practice a situation. Here's how it might go if you called the doctor's office to make the appointment for yourself. Ring, ring, hello. That's what I do all the time. You can remind them of coping skills that work for them. I know you're really nervous about this party that you've been invited to and that you really want to go. Remember that sometimes when you're feeling really nervous, it helps to take a few deep breaths. Or I've noticed that you like to take a quick break if it gets to be too much, but then come back. You can remind them of what works for them. If they're verbal, you can ask them about a time when it went well. what happened last time when you talked to that friend? Did they make fun of you? Okay, well, that's good evidence that maybe this time will go well too. And then gently challenge any unlikely thoughts. You have to do this one carefully because you really don't want to communicate to the person that you're not understanding them or that you think that their worries are silly. Our worries are really important, and they're our brain's way of alerting us to potential threats. But if the threat is not really a threat or is not likely a threat, we can help them think it through. And then the biggest thing that I want to emphasize is reducing accommodation over time. We talked about how avoidance doesn't help. So if you are frequently making phone calls that your child is able to make for them because they're too nervous, or talking for them when family friends come over and answering the questions for them because they're too nervous to answer, or telling them you don't have to go to the party, just stay home, your friend will understand. All of these things make a lot of sense to me. But we want to start to reduce those over time so that the avoidance goes down over time and that the person can gain that confidence in their own abilities to manage their anxiety and do like social situations that make their life good. So if you think it would be really helpful for them to make these phone calls and currently you're doing it all and you think they know how to do it, but they're just too nervous, have them sit in the room when you make the phone call, put it on speakerphone for a while and have them be right there with you. Have them practice with them the phone call and have them do the first little bit, and you'll be there to jump in if they get lost, and then work towards having them be able to do it. Same with all these situations that you can use these skills, but slowly work towards it. Of course, it's going to be frightening if someone is just like, okay, make the phone calls all by yourself now. I'm not here anymore. Bye. But we want to make that the goal of reducing that accommodation that leads to avoidance. I'm going to turn it back over to Dr. Friedman now for medications.
Thank you. So when we're thinking about whether to introduce medications, the first thing we want to consider is the risk-benefit ratio. So some helpful questions that I like to ask my patients and their families is, how frequent and intense are the social anxiety symptoms? How are they interfering with functioning? Are they getting in the way of school or work or relationships or other obligations that a person has? And in your conversations with your physician, you should develop an understanding of how medications can be helpful, what kinds of improvements you can expect, but also the potential adverse effects. When we're selecting a specific medication, it's also helpful to think about, are there co-occurring behavioral, neurologic, and/or psychiatric issues that we can also treat? So is there one medication that could potentially target both the anxiety as well as other issues? And one example of this is if there's a medication that happens to be more sedating, that could be a really good choice for somebody who has social anxiety, but also has sleep difficulties. Trying to minimize the number of medications you need, but tackling multiple issues if you're able to. Next slide. So the big caveat here is that there are actually no controlled medication trials in patients with ASD and social anxiety disorder. So our literature does not give us any kind of particular guidance when we're selecting medication. And what we do is we extrapolate from the research that has been done in neurotypical populations and use that to help guide our decisions. Next slide. So when we're thinking about generalized social anxiety disorder, there are four main categories of medications that we often will consider. The first is the selective serotonin reuptake inhibitors, or the SSRIs. And I've listed for some of the categories, some of the more popular choices. So those are things like sertraline or paroxetine. There's another class of anti-anxiety antidepressants known as the serotonin norepinephrine reuptake inhibitors, or SNRIs. And within that category, venlafaxine is a medication that is often used for social anxiety, has evidence for its use. Another category are the benzodiazepines. These are very classic anti-anxiety agents. They're used broadly for a whole range of anxiety issues and sometimes for sleep and a host of other, mental health challenges. And then finally, another category that we can sometimes think about, although it's never often our first line choice, would be the anticonvulsants or anti-seizure drugs. And then I also just wanted to mention performance-only social anxiety disorder. That is when the fear is restricted to situations in which the individual is speaking or performing in public. So there's not a generalized social anxiety disorder. It's very particular to those situations. And for performance-only SAD, we can use things like the beta blockers. These are blood pressure medications that actually have efficacy for these performance-only anxiety situations, but are actually not particularly effective for generalized social anxiety disorder. And another medication category that's used for this particular indication is the benzodiazepines. And so one of the things that we want to think about is, does a person need medications that are given on a standing basis, so something that they take every day, the set schedule, or could we use something on an as-needed basis, or what we call PRN? So if a patient has generalized social anxiety disorder and it's interfering with their functioning most days across multiple settings, most likely they're going to end up on a standing medication that they take consistently. If someone has performance-only social anxiety disorder, when they only get really anxious when they have to give a talk to a group of 15 people or more, that's where a PRN medication would be much more effective, and we minimize potential side effects by not having them take something every day if they don't need it. So we want to open it up to questions. Again, if you're able to put them into the chat, that's probably the most efficient way to communicate any questions that you might have. If people are uncomfortable because of the recording and process, we can also delete this section of the talk before we post it on the website, so we can do our best to protect confidentiality and those kinds of things. But please, if you have any questions, feel free to put them into the chat. We've answered everybody's questions, I suppose.
Talked really fast so that we could have some time for questions. So.
And if people feel more comfortable unmuting or would rather just verbally talk, that's fine too. We can stop the recording and make sure. So I just wanted to respond. I see one medication question that came up. Okay, so some questions about, do I have a preference for medication? I really don't. I tend to start with the SSRIs for generalized social anxiety disorder. And I'll look also at family history. So if there are other individuals in the family who have taken anti-anxiety, antidepressants, and have done well with a particular medication or a particular class of medication, that can be a helpful place to start. I also see a question about, are there medications that help with sleep and social anxiety? Yes and no. So the benzodiazepines, some of them are often used as sleep aids. They're not my favorite sleep medications, but they can be sedating. So again, that might be something to consider. And then I will maybe let Dr. Hartnett respond to the question about mindfulness activities that kids seem to really like, which is a great question.
Yeah, that is a good question. Mindfulness activities vary a lot. When I'm talking about specifically social anxiety, usually I'll practice sort of attention training. That's kind of the best evidence for social anxiety specifically. One way of doing that is by sort of straight mindfulness activities. One that I do quite frequently with a lot of teens and adults is kind of a sensory grounding activity, looking through 5 senses. Sometimes we'll stop at 3 because people have a hard time doing taste and smell, but I might have them look around the room for 5 pleasant things or 5 positive things in their environment, or 5 red things or 5 blue things or whatever. And then listen for the sounds around them and just really get themselves in the environment that they're in. Touch some textures around them. And then sometimes we'll do smell or taste depending on the person and their preferences. Sometimes we'll do mindful breathing, noticing your breath. That can be easier or harder depending on the person and their skills and preferences. We also just do like mindful walking and noticing the things around us. Sometimes I'll do more mindful activities of like paying attention, observing, labeling, or noticing. But for social anxiety, what we do most is observing and paying attention to the person across from you, listening to what they're saying. So that's why the listening comes in. We sometimes practice listening specifically for the other person, listening for cues, for times to ask a question, things like that, but focusing on the conversation or the situation that we're in. I think that's all I'm going to say about that right now, but there's a lot of mindfulness activities out there that can be really great for different people. So I can't say for all people.
Great.
I saw a couple. Go ahead.
I was going to say there's some great questions coming in, and Dr.
Yes.
Hartnett, you maybe could talk about how CBT can be incorporated into a daily routine at home.
Oh, yeah. Okay. I can jump down to that one. So CBT incorporated into daily routine home. If your young person is in a CBT program specifically, I always want to make sure that we're doing those things at home, like practicing relaxation skills and coping skills, first in calm environments like before bed, and then in the real world during stressful situations. And sometimes having parents there to remind the person is really, really helpful for our treatment. We always do homework, so exposure homework of things to go and do at home, and sometimes parents can help facilitate that. If the person is not in a CBT treatment, some of that last slide that I was talking about was how can you incorporate some of these principles into your daily life? This is helping them pause, do some coping, and before avoiding, see if you can do some problem solving around the situation, make it approachable, and then help them approach with some support or guidance or practice or teaching, whatever you might need. And then I almost always recommend that people, practice setting goals that are in their daily life. They might not even be exposure exercises. It might just be like, I do want to reach out to that friend and, get myself in more social situations, even though I'm already comfortable with this friend. I want to build my friendships. So we will set that kind of thing. And you can do the same things. What are your goals? What do you want? Are you interested in having more friends? What's getting in the way? Where's that anxiety getting in the way? So stopping to have these conversations can be really helpful.
I wanted to respond to one question that came in about medication. Does it help overcome the anxiety like reducing accommodation does? This particular person likes the no med approach because it seems to help develop a resistance, but the medication may just be masking the problem without any solving. And that's a great question, and something that I think many families confront when they're making these decisions about medication or behavioral or therapeutic interventions. And despite my role as a psychiatrist, I'm actually not somebody who pushes medications, I feel like, unnecessarily. So what I try to engage families about in conversation is, again, to what degree are the symptoms interfering and impairing functioning? And for a number of individuals who have really significant anxiety symptoms, they may be so paralyzed by that anxiety that they're not able to access the CBT strategies or the mindfulness strategies without something that helps dial down the intensity of their anxiety in those moments. And that's where I think medication can be particularly helpful. If it dials down the intensity to a level from 10 to 8, but that allows them to walk into the dreaded situation and to start using the coping skills that they're learning in therapy, then that to me is a win. It doesn't mean that somebody's going to be on medications for their entire life, but it means that at least they're getting the help that they need to be able to put those strategies into play in the real world. So that's one piece that I like to sort of think about with families.
Record, I absolutely agree. And it really depends on the person, but it can really help to, like she said, take a 10 from a 10 to an 8 so that you can take that first step. Because like I was talking about with avoidance, that cycle is powerful and really natural, and it's unnatural to take that first step outside of it. So sometimes for some people, medication can be the way to build that or reduce that anxiety enough to make that step. I saw a couple questions on here, Nora, about how can we differentiate if it's social anxiety or sort of just part of the normal autism spectrum experience. This is tricky from like a big philosophical level, but from a really concrete level, if it's interfering with life above and beyond other things, if it's the anxiety and the fear of being negatively evaluated or rejected or being super uncomfortable in a social situation means that you avoid social situations, and it's about the social situation and not about something else, like sensory stimulation, then I usually would be doing some checking for social anxiety disorder. The social anxiety disorder, the criteria say that it has to be impairing important life areas, and that the person has to be either avoiding or enduring with intense anxiety. Where I get tripped up a little bit is if the person is not able to clearly verbalize their thought process. And so that's when we might say they have significant social anxiety, but it doesn't quite meet social anxiety disorder because of how their symptoms present or how their cognition works. But we might still treat the social anxiety. So it's really, is it about a fear of social situations because of scrutiny, because of how you'll be perceived or how you'll feel because others are, judging you? That's social anxiety. Just discomfort with social situations because they're uncomfortable, but you don't really have any fear of something going wrong, or not knowing what to say, and that's uncomfortable, but it's not significantly impairing, and we're not worried about how the other people are going to react, then that's not social anxiety. That would just be some people's experience of being on the autism spectrum.
I would add to that regardless of whether somebody meets full criteria for social anxiety, if they're presenting with features of social anxiety without the D disorder piece, we can still use a lot of the same therapeutic and behavioral approaches. It's important as caregivers and family members and clinicians to understand what's driving those socially avoidant behaviors, but we can use the same CBT principles to try to reduce accommodation and avoidance and set up an exposure system. So the principles are still operational, even if somebody is not fully reaching the threshold of a social anxiety disorder diagnosis. Somebody also posed a particular question about school avoidance, which I think is just worth mentioning broadly, because school avoidance is something that is, something that I'm sure both Dr. Hartnett and I see quite a bit. And particularly after the pandemic, with that reentry anxiety that we discussed for kids who were out of school for months at a time, if not longer, maybe had done a hybrid school year in 2020 to 2021, that return to school for people with anxiety could be intensely challenging. And so here too, those principles that Dr. Hartnett lay out about CBT, about setting up exposures, understanding the avoidance cycle, reducing accommodation, those are really applicable to a whole host of different anxiety triggers, whether it's social anxiety or school phobia or separation difficulties or generalized worries. So those principles underlie really our treatment approach across a whole range of anxiety disorders. And just to follow up, somebody had asked whether Dr. Hartnett, you use DBT, since there are neurodiverse DBT programs and curriculum for intellectual disability.
Yeah, I was just going to comment on that one. Yes, I do use a lot of DBT strategies. DBT is a package of a lot of cognitive behavioral strategies and mindfulness that's been tested a lot. It's kind of a specific package, although some people do modify it or use parts of it. And it falls under the broad category of CBT, but sometimes people put it separately, sort of. I do use a lot of strategies from DBT, depending on the person. I have a lot of different strategies in my tool belt, and so I always try to individualize my treatment I do see a lot of folks with intellectual disability for anxiety treatment, some of whom have social anxiety. And so we use a lot of CBT strategies, a few DBT strategies. It's just sort of a mix, depending on what I think that person needs. But DBT is a great modality that can be helpful as like a package for folks with social anxiety as well. I also saw a question about staying up all night, socializing, playing video games and stuff like that. I see this a lot. It's a really tough call for me a lot of the times, but sleep is one of the most important things for overall anxiety and for mental health in general, and for attention and lots of other things. And so teens do have a slightly different natural sleep schedule than adults or kids, but staying up all night often is a no-no for me because just lack of sleep, if you have to get up in the morning for school and you've only gotten a few hours, lack of sleep is a huge trigger for depression, anxiety in general, social anxiety, also attention difficulties, health difficulties. And so we try to find a balance there of how late is reasonable to stay up. How do you say to your friends that you'll see them another day, which social anxiety can play a role in, and then working out some different plans and asking if people can play at different times, things like that. But this is a very common problem, and it's tough because socializing is important to mental health as well, but sleep is kind of my number one. So see if we can.
I would also get curious about what staying up all night and sort of shifting the sleep-wake cycle is serving that individual. Like, what are they managing to avoid during daytime hours by staying up all night and then sleeping presumably through the day? Is it impacting school? Is it impacting their, employment, whatever it might be, their time with family? So yeah, I think a balanced approach, but really getting curious about what other functions that might be serving is important. Let's see. We have time for one more question. Somebody asked about resources to access mindfulness. I will just throw out there are a number of apps, mindfulness apps that you can download on a phone or an iPad. Calm. There's some other ones, Dr. Hartnett.
I mean, Calm is the most easily accessible one, but I don't know if I have a really good recommendation off the top of my head. I think there's some good lists online.
Exactly. And then there's plenty of websites that I think can walk you through some of these basic mindfulness steps. They're all packaged a little bit differently, but the underlying concepts are the same. And some of it is trial and error, what your child or your family member responds to. Is it the deep breathing? Is it guided imagery? Is it progressive muscle relaxation? So, trying a variety of things until you find one that seems to be a good fit. Right. Thank you, everybody, for joining us tonight. I hope we were able to address some of the questions. Sorry, I've got one great one, which is a lot of podcasts about anxiety. Do you have recommendations of ones to avoid or use? This is totally true. And I just myself probably consume a very small percentage of the podcast literature or, offerings. I will mention 3 psychologists whom I do follow and find usually give very helpful advice. They have sort of different targets in terms of the age groups that they work with. But for teens in particular, Lisa D'Amour, Ask Lisa, is the name of her podcast. She also writes for the New York Times and other publications. She's published a number of books now. I think she is absolutely wonderful. And she focuses a lot on the adolescent years. She's not specifically talking about neurodiverse populations, but again, a lot of these nuggets of CBT strategies are going to be really helpful for anybody, and you can adapt them as needed to fit, the particular needs and profile of your child. Yes, I will put the name of the podcast in the list. Ask Lisa. Her name is Lisa D'Amour. Great. Thank you, everybody, so much for joining us.
Everybody.
Great night. Bye.
Bye, everybody.